What is Lewy body dementia?
Lewy body dementia, LBD, is the second most common neurodegenerative dementia, and it is associated with visual hallucinations, Parkinsonism, and fluctuations in cognition. Lewy body dementia is primarily in two neurologic diseases, Parkinson's disease and Lewy body dementia.
LBD is a disease associated with Lewy bodies, which are cytoplasmic inclusions found in cells of the substantia nigra, and abnormal deposits of a protein called alpha-synuclein in the brain. These Lewy bodies affect chemicals in the brain whose changes, in turn, can lead to problems with thinking, movement, behavior, and mood. LBD affects more than 1 million individuals in the United States. People typically show symptoms at age 50 or older, although sometimes younger people have LBD. LBD appears to affect slightly more men than women.
Diagnosing LBD can be challenging. Lewy body dementia can occur alone or along with other brain disorders. It is a progressive disease. The disease lasts an average of 5 to 8 years from the time of diagnosis to death, but can range from 2 to 20 years for some people. How quickly symptoms develop and change varies greatly from person to person, depending on overall health, age, and severity of symptoms. In the early stages of LBD, symptoms can be mild, and people can function fairly normally. As the disease advances, people with LBD require more help due to a decline in thinking and movement abilities. Some LBD symptoms may respond to treatment for a period of time. Currently, there is no cure for the disease. Research is improving our understanding of this challenging condition, and advances in science may one day lead to better diagnosis, improved care, and new treatments.
For the DSM-5, a diagnosis of neurocognitive disease with Lewy bodies requires at least one core diagnostic feature or two suggestive diagnostic features. The three core features are fluctuating cognition with pronounced variations in attention and alertness, recurrent visual hallucinations that are well-formed and detailed, and spontaneous features of Parkinsonism, with onset subsequent to the development of cognitive decline. The two suggestive diagnostic features are, meets criteria for rapid eye movement sleep behavior disorder and severe neuroleptic sensitivity.
What are the causes of Lewy body dementia? The precise cause of LBD is unknown. Accumulation of Lewy bodies is associated with a loss of certain neurons in the brain that produce two important chemicals that act as messengers between brain cells, acetylcholine, which is important for memory and learning, and dopamine, which plays an important role in behavior, cognition, movement, motivation, sleep, and mood. Age is considered the greatest risk factor. No specific lifestyle factor has been proven to increase one's risk for LBD.
Other known risk factors for LBD include Parkinson's disease and REM sleep behavior disorder. Having a family member with LBD also may increase a person's risk. Variants in 3 genes, AP, SNCA, and GBA, have been associated with an increased risk.
What are Lewy body dementia signs and symptoms? The most common symptoms include changes in cognition, movement, sleep, and behavior. Visual hallucinations occur in up to 80%, often early on. Non-visual hallucinations are less common than visual ones, but may also occur. Unpredictable changes in concentration, attention, alertness, and wakefulness from day to day and sometimes throughout the day. Ideas may be disorganized, unclear, or illogical.
Severe loss of thinking abilities that interfere with daily activities. Movement problems and Lewy body dementia. Muscle rigidity or stiffness. Shuffling walk, slow movement, or frozen stance. Tremor or shaking, most commonly at rest. Balance problems and repeated falls. Stooped posture. Loss of coordination. Smaller handwriting than was usual for the person. Reduced facial expression. Difficulty swallowing. A weak voice. Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.